Hello, I'm Sue Brosendale. I work for VOSCA and I'm standing in for the Voluntary and Community Sector Advocate on the Health and Wellbeing Board. That position is vacant and we are currently recruiting for that. Check out our link below this video if you are interested. So I'll give you a quick run through of what happened at the meeting on the 17th of June 2015. First agenda item was about extra care housing. Some of you may be aware the council's doing a big project with 122 units for extra care housing. This was a formal approval of the council to forego £3 million worth of land receipts for that. Big paper with lots of really good reasons why that was actually a really good investment for the council. They will get that savings back in the long term from care, and they do get 100% nomination rights for social rent and shared ownership for the development. So got big approval all round. There's a paper about that if you want to read further about it. Next agenda item was Children's Community Health, presented by Bristol CCG. North Bristol Hospital Trust and Barnardo's have been delivering the service, which is up for recommissioning. The CCG had asked them to extend that contract for a further year whilst they do a bit more in-depth work on service redesign and the whole consultation period. MBT Trust said no, they would not do that. So now the CCG are in the difficult position of having to find a provider for a 12-month period from March 2016 to 2017 when the new big contract starts. Far from ideal. However, they're feeling confident that that will work okay. They've got a market event on that in July with 20 bidders, so at least there is some interest for that 12-month period. It will just be running the existing service, and there's lots of reassurance about robust control and management systems in place to cover that period. They're also obviously looking at the lessons learned for the new model about why MBT felt disinclined to continue for a further year. There's a press release about this that's gone out to everybody on our Children and Young People's Network, but I would ask you all, if you work with children and young people, just to be aware there's going to be an awful lot going on behind the scenes in the next 12 months about this 12-month interim provider of services, and just to be a little bit more vigilant than you might perhaps normally be about how services are running. If you have any concerns, get in touch with Bristol CCG. Mike Pingstone, that's Pingstone, at Bristol CCG 976 6600 is the lead commissioning officer for that 12-month contract. So fingers crossed that will go well. If you want to know more, do have a look at the fuller paper below this video report about that. Next agenda item was also about children. It concerned children's oral health. Apparently a quarter of all those under 5 suffer from dental decay, and in terms of numbers, that's the most significant health issue for that age group. Bristol, apparently, from a small sample and a work on a report done last year, has a worse track record than the national average. So Public Health have done a strategy paper about how they want to plug that gap, and there's a general call out for everybody working with children and young people to remind people that dental checkups are free for children, and to make sure that those young children, and indeed all children, see the dentist regularly and think about oral hygiene. It does have a huge impact. Have a look at the paper about that particular piece of work. Next agenda item was on the Joint Strategic Needs Assessment. That's the board's responsibility to prepare the core data for Bristol about its health and well-being across the city. It's a big piece of data gathering that all councils are responsible for. Bristol is having a big review of how they do that, with lots of changes, more resource, and two things I think that will hearten many of us in the voluntary sector. One is a much improved and easier access website, and the other is that data is put on that website in chapters, so you can then go to a health thing like older people or social isolation and bring up all the core data that is held about that particular topic. That's a model that other local authorities use and was recommended. That did get the universal support of the Health and Wellbeing Board to go ahead with those developments. I'm sure VOSCA will be reporting on those developments as they proceed over the coming year. Final item was on the Better Care programme. The board have responsibility for the implementation of Better Care, and they had a verbal update about how things were going, which was just a quickie to say that things were pretty much on track. There was not much detail on that, except to say that Bristol has met most of its targets, but not all, and the ones it hasn't met, sounds like most people haven't met them and we're likely to meet them next time, so there's no concerns about our performance overall. There's going to be a review of governance with Better Care because it's currently a programme board, and that does need to look at, because it's a really big programme and does have a long timetable. The Health and Wellbeing Board, really interested in Better Care, and there was a request from the board to get a fuller report in writing about the detail of this, so the board could have give a stronger leadership role and fulfil its duties properly with regard to Better Care. So that was agreed, and we should be seeing a fuller report in due course. A note there, anybody who's interested in social prescribing, which is part of the Better Care programme, there will be a special paper to the Health and Wellbeing Board in their August report about that, and we will be sending out to our Health and Social Care Network an update about social prescribing quite soon. Next meeting of the Health and Wellbeing Board is the 19th of August, so if you are interested in being our voluntary advocate for the sector, please have a look. Our recruitment drive is now on. Thank you.